We're now to Chapter 10, and Chapter 10 is a hodgepodge of random things. It's focused on the cardiovascular system as kind of the main component, but then because of the nature of that, it also is going to lump in immune system as well as lymphatic system and then general terms about the blood. So it's kind of a long monster chapter. So first we're going to kind of go through the parts and then we'll get through the medical terms that goes along with it. So in general, the cardiovascular system has some main components. The heart is the heavy hitter there, but then it also includes all of the different blood vessels that go throughout your body. So there's arteries that go away from the heart. There are capillaries, which are those smallest blood vessels responsible for gas exchange. And then there's veins that then return back to the heart. Thinking about what, that then system does for you, it has a heart that pumps. So, for example, jumping ahead, going a little crazy there. So overall, as your heart pumps, it's doing two things. The right side of your heart is pumping blood to the lungs, so that's your deoxygenated blood. So it goes to the lungs to get rid of its CO2 and pick up oxygen. And those capillaries by the alveoli, which we kind of learned a little bit about in Chapter 5. The left side of the blood then takes that oxygenated, the left side of the heart takes that oxygenated blood and then pumps it to the rest of the body. Within that exchange process, you are exchanging CO2 waste for oxygen, but then there's also nutrients and things like that that can exchange also at that capillary spot. The blood in and of itself carries that waste product from the tissues to the veins to the organ of excretion, which in this case would be your lungs. So here's a picture of the heart. You might have had to learn this in other previous classes. There are 4 main chambers that we'll learn about. And you can kind of see in the picture here, the patient's right is your left when you're looking at the screen. There are atria on the top, there are ventricles down below, and we have some valves that kind of separate that. So I'll touch a little bit about it as we go through. In the colored notes, the blue would mean deoxygenated blood. So as I mentioned, the deoxygenated blood would come in through the vena cavas to the right side of the heart. So this would be the right atrium, and then it would come down here to the right ventricle, and then it would go up through what we call the pulmonary artery. So then this would connect to the lungs. Your blood would get oxygen and then come back in through the pulmonary vein into the left side of the heart. So the left atrium, the left ventricle, and then up and out the largest blood vessel in your whole body, the aorta, which would then pump the oxygenated blood to the rest of your body. So this is kind of just going into a little bit more of what I just mentioned. The heart in and of itself is a muscular organ, and it's about the size of a fist, and it's located in between the lungs. If we remember, you have 2 lobes on one side of lung on your right side, and then 3 on your left side. You have 2 on your right side. You have 3. So that way you can situate the heart in there. The upper chambers are the atria, for plural, atrium is singular, and then the ventricles are the ones down below. Separating the atria and the ventricles, we do have valves. In this case, we have what we call a tricuspid and a mitral valve. And their job is to basically prevent the backflow of blood. So it's kind of supposed to be a one-way direction. We have the tricuspid one over here, and then we have the mitral one over here. And so as the blood pumps and then releases, these valves close to prevent it from backflowing in the wrong direction. You also have what we call semilunar valves. These, we have a pulmonary one right here, and you have an aortic one right here, and it serves the same purpose to kind of prevent those backflow to keep it flowing in the right direction. Surrounding the heart, we have what's called the pericardium, and we know peri means surrounding. We'll learn cardio means heart. So this surrounds the heart. There's also a fluid secretion that goes along with it that kind of helps lubricate the heart as it continues to beat. Overall, there are 3 layers to the heart. It is a muscular organ. There's an endocardium on the inside. There's a myocardium, and then there's an epicardium. What we traditionally think of as, the heart muscle, that's the myocardium. If I go back to this picture here, this lighter picture, pink here, that's that muscular myocardium. And when you have a heart attack, that's the area that's having a trouble. The inner lining here, that's the endocardium. And then the epicardium would be on the outside, so that outer layer here, and then surrounding all of it you would have the pericardium. Okay, so holistically here we have blood vessels, which artery means away, vein means toward the heart. Generally, arteries are carrying oxygenated blood, except for the pulmonary artery and pulmonary vein. That's the exception to the rule. But it takes it away from the heart towards the tissues, and then the arteries turn into arterioles, which turn into capillaries. Similarly, in Chapter 5, we learned about the lungs, and we had the bronchi and the bronchioles into the alveoli. It's kind of the same kind of tree-like breakdown process. And as I mentioned, the aorta, which is the largest blood vessel in your whole body, the largest artery. It's very thick and muscular because it then needs to pump to get blood all the way to the, top of your head to the tips of your toes. Veins usually carry blood that have the carbon dioxide and the waste products back to the heart to then get reoxygenated. Except for the pulmonary vein. That's the one instance where the blood has been oxygenated by the lungs, and then that's going back to the heart to get then pumped to the body. The tiniest parts from capillaries, that starts to pool together into venules, and then that pools together into larger veins called the vena cava. You have a superior one, and you have an inferior as well. So next we're going to move to the blood. If you're thinking about what is the purpose of your blood, it transports, so it's the highway with which nutrients, waste, oxygen, and other things get to move around, even hormones, which we'll learn about in Chapter 16. It's protection. Oftentimes that is where the immune system cells lie, which we'll learn about also in this chapter. But anytime you get some kind of infection, then the blood can help fight that. And then regulation. If you think about your blood as kind of a warm liquid that's circulating around your body, it helps control your body temperature as well as electrolytes, which are floating around in your blood. So here's just a picture of kind of what is in your blood if you never knew. Most of your blood is going to be water, actually. So over half of your overall blood is water and solutes, or collectively known as plasma, the liquid portion of your blood. And that leaves about 45% for actual cells. So of the cells, most of them are red blood cells because those are the ones that are carrying oxygen, very important. But you also have leukocytes. Those are your white blood cells, part of the immune system. And then we also have what we call platelets, or thrombocytes. And these are the clotting cells. So anytime you cut yourself, they're responsible for stopping the blood clot and kind of scabbing over that area. And then collectively, blood in your body is about 8% of how much you weigh. Touching on the lymphatic system, it does have a couple organs that go with it. It consists of all the different lymph, which is a liquid that goes through your lymph vessels. You also have lymph nodes, especially the ones in your neck that like to get inflamed when you are sick. Also playing in this role, we have the spleen, which is kind of in your mid-left side. We also have a thymus, which lives kind of right above the heart area. So those are kind of key areas, and you can kind of see throughout this picture here where those little balls, those little lymph nodes are. And there you can see that they're in many locations around your body. When you're thinking about what is the job of the lymphatic system, oftentimes what it does is it kind of acts as a drainage system. So anytime you have too much fluid in your tissues, it tries to then return it to the blood so that it can be filtered out by your kidneys, and then you'll just pee more and kind of get rid of that extra fluid. It also helps collect other additional fluids and drains the cardiovascular system to kind of keep any fluid from building up. It also absorbs fats and other vitamins from the small intestine, so it kind of does play a role in keeping you healthy and providing defenses against infection. As I mentioned on the diagram, the lymph itself is kind of a fluid, and it contains lymphocytes, which is why it's called lymph. So those are your, white blood cells that can fight infection. So that's why oftentimes if you're getting sick, your lymph nodes around your neck get huge because they're packed full of lymphocytes trying to fight your infection. Lymph vessels are similar to blood vessels, except instead of carrying blood, they're carrying lymph to a large vein in your chest. I think on the picture, you can see that large green vein right here kind of goes right in front of the heart there. Your spleen, lymph nodes, missed them. Those are little nodules, essentially, and they're acting as little filters. So again, when you're sick, they get inflamed because they're trying to filter and trap as much bacteria as they can to keep it out of the blood. Your spleen is the largest lymphatic organ in your whole body, and even though blood instead of lymph flows through the spleen, it's cleaned by what lives inside the spleen. Its job is to store blood, and your spleen also kind of gets rid of the worn out blood cells. So you can live without your spleen, but it helps to degrade your old red blood cells because they only do have a shelf life of so long. Your thymus gland is located kind of a little bit behind your sternum, right above the heart. And again, that's going to play in with the immune system. Especially when you're younger, between infancy and puberty, it kind of helps develop that immune system. And speaking of, the immune system itself doesn't have special immune system organs. It kind of piggybacks off other systems items. So especially the lymphatic system that I just talked about, we have the spleen and the lymph nodes. We also have the liver, which acts as a filtering tool. The intestinal tract, is full of bacteria, acts in there. Bone marrow, which makes blood cells. All of these different things depend or contribute in some way to your immune system function. Interestingly, they also believe that, the appendix, which was thought to not really have a job, now has a role in immune system. The job of your immune system sounds pretty straightforward. It's to prevent yourself from getting sick. So there's kind of different things that you can do. So initially we have chemical barriers, so like earwax prevents bacteria from getting into your eardrum. Saliva, our skin is a mechanical barrier to prevent pathogens from getting in. If they do get in, then we have parts of our immune system. So we have natural killer cells, phagocytes to try to engulf and eat those bacteria. We can get inflammation, we get a high fever, and so on. And then we have a third line of defense, our antibodies, which then go into fight. So the second and third lines of defense here really do play into our immune system. Okay, so how is the lymphatic system different than the immune system? Or are they really the same thing? Well, in this case, they are different in the sense that the lymphatic system does have its own organs, and really it's responsible for circulating lymph tissue. Parts of the lymphatic system contribute to the immune system, but the immune system's main role is to fight infection and can really pull from parts of many different systems. All right, so now we're to the actual word parts of this whole thing. And I will say that this chapter is broken up a little bit differently in the way that it presents the words. It kind of does it by cardiovascular system, and then lymphatic system, and then blood. So there's lots of different little tables depending on what part of this whole thing it's talking about. So like this is cardiovascular, lymph, and blood. Angio, it means vessel. Specifically in the context of this chapter, it's going to mean a blood vessel. Aorto for aorta, arterio for artery. So really, if you're talking generally about any artery, you would use arterio, except for the aorta, which is one specific artery that you might talk about. Atrio for atrium, whether it's the right or the left. Cardio for heart. Lympho for lymph. And then if we're talking about a lymph node, they kind of use it in the context of a lymph gland. So it would be lymphadeno for a lymph gland or lymph node. Myelo, we have seen several times before. In this case, it's going to mean bone marrow. So we did also learn that it means spinal cord in chapter 15 a long time ago. But in this case, it means bone marrow. Phlebo and veno both mean vein. So phlebo shows itself sometimes, like a phlebotomist is the person who draws blood from your veins. So that's where you could see that, but most of the time it's going to be veno. Plasmo for plasma, spleno for spleen. Note that spleen is a word that has two E's, spleno only has one. Thymo for thymus. Valvo and valvulo could mean any of the heart valves. And then ventriculo is ventricle. I do have to say that for this chapter, all of these terms pretty much sound exactly like the word they go for, so that is a plus. Add these words to your diagram. There's also a picture in your book on page 359 that you could label as well. The ones used with the cardiovascular and lymphatic system, we have athero, means yellowish or a fatty plaque. So if you get fatty plaque buildup in your arterial or vein walls, usually arterial walls, you can have some problems. Echo means sound, so if you're going to do some kind of recording of the heart. Electro for electricity. Ischio means a blockage or a deficiency. We did learn at one point ischemia would be a deficiency of blood flow, for example, to the heart. Thermo for heat, and then thrombo for a thrombus or a blood clot. And I kind of talked about this, I think, in chapter 5. A clot in one particular area that hasn't moved is called a thrombus. If that then dislodges and moves, then it becomes an embolism. See if you can add these to your diagrams. We do have some prefixes and suffixes. Brady means slow. So this is the opposite of tachy that you learned in Chapter 5. So tachycardia, for example, would be a rapid heart rate, whereas bradycardia would be too slow. Pan means all or total. We learned that a long time ago with like total paralysis, paraplegia. AC as a suffix means pertaining to. Apheresis means removal. The term that I always think of is plasmapheresis, where you remove just the plasma portion of your blood. It's a little bit different than synthesis, but they're very similar. Penia means an abnormal reduction in number. So if you have reduced number of blood cells, for example, you would use penia as a suffix. Poesis, hematopoiesis, for example, is the formation of new blood cells. And then sclerosis, I believe we've seen before, means a hardening. So when we had the ear, we had otosclerosis for a hardening of that part of the ear. In this case, we're probably going to have atherosclerosis for hardening of maybe the arteries or plaques around that. So which one of these means vein? Arterio means artery, phlebo means vein, and valvo means valve. Okay, so we're finally to the part of getting to some diseases, and really so far the chapter's not so bad. So as you'll notice in the table on page 362, there's a chunk that starts off with just the cardiovascular system, and then there's a chunk that goes in with the blood, and then a chunk that goes with the lymphatic system. So if it looks out of alphabetical order, it's because they kind of start over a couple times. These are all the ones for the cardiovascular system. Most of them are all things we've seen before. So we have stenosis, if we remember, means a narrowing. So you can have angiostenosis if a blood vessel is narrowing. If it's specific to the aorta, you could have aortic stenosis. Oma, as a reminder, means tumor. Sclerosis, we just mentioned, was a hardening of different areas. Megaly means enlargement. So if your heart is enlarged, you could have cardiomegaly. If you're having heart problems, most of the time it has to do with the muscular myocardium. So if you have cardiomyopathy, then you have a disease of your heart muscle. If you are specifically having trouble with the interior lining of your heart, that would be endocarditis, for example. Ischemia, as I had mentioned, means a deficiency of blood flow, in this case probably to the heart. You can also have myocarditis or pericarditis, depending on which layer of the heart is inflamed. Let's see. This is just a weird one to say. Thrombophlebitis would be inflammation of a vein due to a blood clot. So there's a thrombus that's causing inflammation of the vein. So these aren't too bad. These are the ones that on the left go with the blood and on the right go with the lymphatic system. Same thing. I feel like we've seen this word before. Erythrocytopenia. So this would be a deficiency in red blood cells. A hematoma would be, technically it means a tumor of the blood, but usually it's a broken blood vessel of some kind. Leukocytopenia would be a reduction in your white blood cells. You can have a myeloma, so that would be tumors in your blood marrow. If you have loss of all of your different blood cells, then you would have pancytopenia for all of them. If you have reduction due to a clot, then you would have thrombocytopenia. Thrombosis is the condition of having a clot, and the thrombus is the clot itself. On the lymphatic side of things, if you have an inflamed lymph node, you'd have lymphadentitis. If you have a disease of that, then you would have lymphadenopathy. You can have an enlarged spleen and different tumors. So take some time to use all of these words. They're not that hard, but there's a lot of them on 365 and 366 in exercise 13. Here's an example of aortic stenosis. So if you think of the valve in the aorta, job is to prevent backflow, but if it narrows, then you can't even get the correct flow in the right way, and therefore you're getting less blood going to where it needs to go and then a buildup behind it. So this would be what a stenosis of the valve looks like. All right. Which one of these has been split up correctly? Hopefully by now you are pro, and B is the correct answer. All right, so here we have a blocked artery for two reasons. There's a blood clot, and there is a fatty plaque that kind of then caused the blood clot. So this would be what? The abnormal condition of the blood clot would be a thrombosis, and the fatty plaque hardening would be atherosclerosis. Okay, so now we're to all the ones that are not built from word parts. So these are a little bit more needing to remember or just straight up memorize. And as you can see, there's a lot of abbreviations that go with this. So the first is acute coronary syndrome. And this is a sudden onset of symptoms where you're not getting enough blood to the heart. And this could be a result of a heart attack that we'll learn about. But basically they need to figure out what's happening with you right away so you can minimize heart damage. An aneurysm is a ballooning of a weakened portion of your arterial wall. So an aneurysm really can happen in many different places. The most deadly would be in your brain. It's where it kind of balloons up. The walls of the artery have been weakened, and then if it bursts, then you can kind of bleed to death that way. Angina pectoris just translates to chest pain. Again, this is usually resulting in a heart problem, but it's chest pain that oftentimes radiates down your left arm and sometimes your jaw, and it can be an indicator for a possible heart attack. So that's one of the things that you look for if pain is radiating down your left arm. Arrhythmia just means your heart is not beating in its normal rhythmic pattern. AFib or atrial fibrillation is when you have an arrhythmia, but it's kind of chaotic. So it's not, your heart is not in rhythm, but it's a result of rapid impulses to the atria. So the heart itself has a little sinus node that shocks the atria to contract. It's its own separate circuit, so to speak. And so if it's not sending regular signals, then you can have atrial fibrillation. And then you might need some intervention like a pacemaker at some point to control that. Cardiac arrest is when your heart stops, and at that point you'll then need CPR. Cardiac tamponade is when your heart gets so compressed that it has a hard time beating, and this is due to accumulation. So fluid building up in the sac around the heart, the pericardial cavity, then compresses the ability of the heart to contract. And so that might be a symptom of a greater issue. Coarctation of the aorta. It's when you are born with a very narrow aorta, in the sense that there's a spot in your aorta where it's very, very narrow on the arch, and then there's going to be circulation problems because you can't get maximized blood flow. Congenital heart disease is just any heart abnormality that's present in birth, so coarctation of the aorta could be one of those things. Coronary artery disease is really a condition that just reduces blood flow. And most often, coronary artery disease is caused by atherosclerosis, or buildup of those fatty plaques on the walls of your arteries. Coronary artery disease is often cause eventual heart failure or eventual heart attacks. Cor pulmonale is when your right ventricle gets enlarged due to pulmonary disease. So you have pulmonary problems, which then, feed into the right side of the heart, and so that's why it can cause problems. Deep vein thrombosis would be a thrombus in the deep veins of your body. So you have very large veins that then go down to your legs and your lower extremities, and oftentimes there could be a clot in there sending kind of full leg pain, and that would be considered a deep vein thrombosis. Heart failure, it's also been called congestive heart failure, but to be classified in this category, it just means that your heart is not working well enough to supply your body with the necessary oxygen and nutrients. So your heart alone is not sufficient to do the job. Next, we have hypertensive heart disease. So this is when you have high blood pressure or hypertension for a really long time. And there's reasons that you could have that. But that's what it's called, and it can cause other issues as well. Intermittent claudication. And this is where you have pain or tension and weakness in a limb, and then it eventually gets worse and worse, and then you rest and it gets better. Really what happens in this case is that's the claudication part, and it's intermittent because it starts and stops, but there are muscle ischemias, so your muscles get deprived of oxygen at random points in your limbs, which then caused the tension and weakness. Mitral valve stenosis, if we remember, stenosis is narrowing, so in this case it would be narrowing of the mitral valve, usually due to scarring as a result of childhood disease, and can cause problems. Myocardial infarction is the fancy word for a heart attack. So a part of the myocardium dies, therefore preventing oxygen from getting to where it needs to go. Continuing on, we have peripheral artery disease. So this is focused in the arteries of the arms and legs, again, mostly as a result of atherosclerosis. Continuing on, we have rheumatic heart disease. So this would be damage to the heart thanks to rheumatic fever at some point. And then last on the cardiovascular list, we have varicose veins. And this is distended or sticking out veins found in the lower extremities. So there's a picture in your book on page 370 of that. It's oftentimes seen in older individuals and oftentimes a result of crossing your legs too much. All right, so here's an example of what atrial fibrillation looks like. You can see on the left you have what's called a normal sinus rhythm, where the atria contract together and then the ventricles will contract together. In the middle, you can see that there's kind of a non-systematic approach to the contractions. So these guys just kind of contract without formally contracting the other areas. And there's different things that you can do. One of the examples here as a treatment, which we'll learn about, is atrial fibrillation ablation. They basically go in and zap those cells that are misfiring. Here's an example of an aneurysm. So again, it's deadly really wherever it is, especially in the brain. But here's an example. These are those deep veins that I discussed. Here's an example where that goes in the center here. And you can see that the walls have been weakened due to atherosclerosis, and that could burst. Here's that congenital condition, coarctation of the aorta. You can see on the aortic arch that this has been narrowed and then can result in circulation problems. All right. Another thing to think about as we will get into the blood area, the first word in the blood list is anemia, which just means that you don't have the appropriate amount of red blood cells. But there's many different ways that you can get to that point. So one is blood loss. So if you lose a lot of blood, then obviously you've lost a lot of red blood cells. So typically, injury and or just giving birth, you can get anemia that way. You could be producing less red blood cells, and there's a ways to do that as well. For example, iron deficiency. I think it's 1 in under 10, I forgot how many, women have iron deficiency anemia. You could have a vitamin B12 disorder, deficiency, which then could lead to anemia, or bone marrow is not producing enough red blood cells, so that could be aplastic anemia. Or you could have what's called hemolytic anemia, where that just means that your blood cells don't live as long as they normally do, so therefore you have less of them. Okay, so that was anemia. An embolus I've already talked about, where that's kind of a blood clot that has dislodged and moved to another area. Hemophilia is an inherited genetic condition where your blood does not clot. So there's a certain coagulation factor, and you're, as a person, would be missing that, and so you have trouble stopping blood loss after an injury. Leukemia is basically cancer of the white blood cells. You have an increase in those abnormal white blood cells. Sepsis is a systematic bloodstream infection. So if you've had some kind of trauma or damage or organ problem, or your appendix burst or something, where bacteria or microorganisms somehow make their way into the bloodstream, then that blood travels throughout your whole body, so you can kind of get a system-wide infection. The 2 words for the lymphatic system here, we have Hodgkin disease, oftentimes called Hodgkin's lymphoma, and this is a lymphatic tissue problem where your lymph nodes get bigger and bigger. And then we also have infectious mononucleosis, or mono, which is an infection by the Epstein-Barr virus, the kissing disease, that's transmitted by saliva. So it is characterized by really swollen lymph nodes, so I think that's why they decided to shove it in this chapter. So work on exercise 17 and 18, that's matching, and there's some good pictures that go along with it in your book too, before you move on to all the surgical terms. We're now going to move on to the surgical terms, and again, these are broken down by the different subsystems that we're talking about in this chapter. So here are some built from word parts. There are none for blood, so these are all of them. All of the suffixes are similar to what we've seen before, so plasty would be a repair, ectomy would be a removal, centesis would be to aspirate fluid, otomy would be to make an incision, and pexy is surgical fixation. So all of those different things are just going to happen at different parts. The only other one that looks kind of weird is endarterectomy, and that's for excision within an artery. So it's kind of like endo and arterio together, but you get rid of the O for endo because arterio starts with an A. So just to kind of use all these in context, try exercise 22 on page 376. And then you can move on to the ones that don't come from word parts. Because there's a lot of them, and here's kind of the list of that, and they are not in alphabetical order because the last couple have to do with the blood, but here we go. So aneurysmectomy kind of sounds like it's from word parts, but it's not, because aneurysm is not a word root, but it just means to remove an aneurysm. An artificial cardiac pacemaker, so that's the little battery powered thing planted under the skin, and then tiny little electrodes go into the heart, and they're usually used to like shock at very rhythmic patterns to control heart rhythm. So if your heart is beating too slow or you're having different an arrhythmia of some kind, then it'll kind of keep you on track. A little bit different from that, we have an automatic implantable cardiac defibrillator. So this isn't like the paddles that you might see when someone goes into cardiac arrest. That's a different kind of defibrillator. This one is an implantable device that just kind of monitors heart rhythm. So it's not a continuous shock like a pacemaker is, but it monitors, and then if it notices that there is a life-threatening arrhythmia occurring, then it will convey a shock to your heart to try to get it back into normal rhythm. So it's more of a monitoring device than a pacemaker that's consistently keeping a normal track. Catheter ablation. So this is where they stick a kind of tube in there, and at the end they have a little laser, for example, or they might heat or freeze, but they get rid of the cells that are firing inconsistently in the heart to kind of control arrhythmias with that. Next is what we call a CABG, coronary artery bypass graft. So this is what happens when there's a blocked artery of the heart, and so they kind of bypass that by inserting a new blood supply or diverting the blood vessel around the blocked artery so that you can then restore blood flow. A stent is kind of a tiny little circular mesh piece that basically you insert in various areas, but a coronary stent is going to go into one of the heart arteries, and its job is to just kind of reinforce the walls and prevent that artery from closing. So there could have been an angioplasty, meaning a vessel repair, or something in which the vessel walls might be slightly weakened, and so the stent is going to kind of reinforce that and hold it open. An embolectomy would be the removal of an embolus or embolism somewhere. Your book talks a little bit about using what we call a balloon catheter to kind of do that whole process, but in general it just means removing an embolism. Femoral popliteal bypass. And really this is where your femoral, if you think about your femoral artery, that's the giant artery that is running, alongside your femur and your upper leg. And oftentimes you could get maybe a deep vein thrombosis in that area, some kind of blocked artery. So similar to a CABG in the heart, this would be a bypass procedure done in your leg. Next we have percutaneous transluminal coronary angioplasty, or PTCA. It's also been called a balloon angioplasty because of the way they do the procedure. So they stick a tiny little balloon into the artery where the plaque is formed, and then they basically inflate the balloon so that when the pressure from the balloon hitting your arterial walls expands, it basically condenses or pushes all the plaques up against the wall and compacts it so that blood can flow a little bit easier. Thrombolytic therapy is the next one. This is really where you get an injection of medication that's job is to dissolve blood clots. So for example, if you show up to the ER and it looks like you're having a heart attack, they'll inject you with some thrombolytics with the idea that it's going to kind of thin your blood and hopefully dissolve any blood clots that you might have to reopen up blood flow. Okay, so the next and last three here really have to do specifically with bone marrow, and there's different things that you can do for that. So bone marrow aspiration is when they suck out a little piece of the liquid portion of your bone marrow. All of this is usually done in your ilium or your upper hip area, but usually from that liquid portion of bone marrow you can determine if someone has leukemia or an infection or some other kind of blood disorder by taking that liquid part. A bone marrow biopsy is when you are taking a solid chunk of that bone marrow, usually from that same place. You can use that to determine if someone has leukemia or anemia or other blood samples. And oftentimes when they're doing this, they do an aspiration and a biopsy at the same exact time. And then finally we have bone marrow transplant, and that's when they take the bone marrow from one individual and give it to a matched individual with the idea that someone happens to have leukemia or some other bone marrow disease, and then when you give them new healthy tissue, then they can use that and get a little bit healthier. Try exercise. You can do 25. 26 has some nice pictures that go along with these terms, just to practice them before we continue on to diagnostics. So here's an example of that word that I had mentioned previously, where you are excising within an artery. So you can see how they're, in this case, pulling out a plaque within the artery. So that would be endarterectomy. Here's an example of what a coronary artery bypass graft or cabbage looks like. You can see how the obstruction here is in this red labeled artery. There's a blockage, so you're not getting oxygen to necessary parts of the heart. You have other ones over here. So it is important to realize that it's sometimes in more than one location. So this person has several grafts, but they basically take a vein, maybe from your upper leg, and they bring it up here, and then they just kind of suture it into place so that when the blood flows through, it kind of bypasses those obstructions so it can still get to where it needs to go. Here's an example of what a stent looks like. So when they insert it in, it's kind of collapsed on each other so it can fit in the artery. It finds an area where there's a lot of plaque. Then they inflate this little balloon that kind of expands the stent, and then they pull out the balloon left, and you have the stent that kind of remains as a scaffold in that area. Here's what the autonomic implantable cardiac defibrillator looks like. So there is the implantable device that kind of goes into here, sits in your chest, and again monitors. There is one little node that goes all the way in here so that if you do need a shock, it'll shock in the right locations. And this is a little bit different than a pacemaker. So a pacemaker is roughly similar in how it looks, but it's going to continuously keep the pace of the heart. Here's what a bone marrow aspiration might look like. As I mentioned, it kind of usually comes from the ilium area of the hip because it's a rather large bone. So this would be an aspiration because they're removing the liquid portion. It would be a bone marrow biopsy if they took a chunk also of the solid portion of the bone marrow there. All right, so which one of these would be performed to remove the fatty plaque of an artery? Atherectomy would hopefully be the correct term. All right, so now we're to diagnostics. There's a ton of different angiographies. So if we think about graphy meaning imaging or taking an x-ray, this would be specifically of ways to take x-rays or radiographic images of your blood vessels. There's a coronary angiography. There's other ways to go about doing it. I'm not going to specifically ask you about all the different subtypes. There is a table in your book on page 381 to kind of help you with that. There's magnetic resonance angiography, which really uses MRIs. There is the computed tomography angiography, which is going to use high-resolution CT scanners. And then there's the digital subtraction angiography. This one is invasive. They inject you with a contrast media, and then they can take pictures, and then after the fact, on the computer, they can do some color manipulation so that your vessels look black thanks to the contrast media, and then the background looks white, which is kind of the opposite of what a traditional X-ray might look like, but it's to help visualize a little better. An angioscope would be the instrument to look at this. Angioscopy would be the process of doing it. We also have an aortogram, which would be the picture of the aorta, an arteriogram, which would be a picture of an artery, and then a venogram, which would be a picture of a vein. And so really to get a good visualization of those things, they all require contrast media. In terms of procedures you can do on the heart, we have an echo or an echocardiogram. So this records the heart's structure and motion. So it's really recording the sound. Not necessarily. The next one, an electrocardiogram, is for the electrical activity. An echocardiogram is listening for the sound. It's kind of really focusing on the sounds of the different valves opening and closing, and gives you an idea of heart function. The electrocardiogram is really the electrical activity of the heart. And then you kind of get a different readout of what's happening, what is the level of contraction at various points throughout the heartbeat. An electrocardiograph is the instrument that you're using to get an EKG. And then the whole process of doing it is electrocardiography. So you do the process of electrocardiography with an electrocardiograph to, at the very end, get a picture of an electrocardiogram. It's kind of confusing. So please try exercise 30 on page 384 to just kind of reconfirm those suffixes, because people are still getting them a little bit confused. All right, so here is the picture of what a traditional EKG or ECG would look like, and it's totally fine to use EKG and ECG interchangeably because they're both used on a regular basis. These are the ones not built from word parts. As we're cruising right along here, there is a ton, so that's why this is just kind of the first chunk. A digital subtraction angiography is kind of what I had mentioned before. This is one that you will need to know. And really it's just kind of post-processing of the image to try to get rid of all the background and focus on what you need to. A Doppler ultrasound. Similar to, how you would do a fetal ultrasound for a baby, a Doppler ultrasound does the same thing, except it's kind of looking at your heart area. You can see blood flow a little bit, you can see deep vein thromboses, and other general valve problems, for example. Next we have Sestamimbly test. So this is a nuclear medicine test that is really used specifically after a CABG or coronary artery bypass graft. They just want to do this test to make sure that blood flow has been started again and is holding, in the sense that the grafts are holding. And it's called this because Sestamimbly is the radioactive isotope that they inject into you, and then they can look at revascularization that way. Next we have a SPECT, single photon emission computed tomography. So a SPECT scan looks at the heart from many, many different angles and kind of can make 3D images, similar to other scans, and then you can use it to diagnose cardiac damage. Next we have transesophageal echocardiogram. So we learned that an echocardiogram is really looking at the sounds of the heart. So this is using ultrasound by kind of sticking a tiny probe down into the esophagus to get a really good view of the heart structure, because just holding it up to the chest doesn't really give you the best picture. Cardiac catheterization is, again, it's in this case a diagnostic procedure where they kind of stick a catheter into the heart to really look at the condition of things that are going on. So they could have a camera at the very end, kind of looking at what's going on, or a probe of some kind. An exercise stress test. So this is really common for suspected cardiac problems. So they, force a person to ride a bike or walk on a treadmill to elevate heart rate, do different things with the heart, and then monitor. So there might be an electrocardiogram or scanning of some kind, but the idea is they're monitoring heart function without exercise, with exercise, different levels of exercise, and all of that. Blood pressure, pretty sure you guys know what that is, or BP. That's however much pressure the blood is exerting on your blood vessel walls. So typically we would have like 120/80 is perfect. Two of the terms we'll see later are systolic and diastolic, which are the two numbered measures that go into blood pressure. Pulse is how many times your heart contracts over a given period of time, so you can feel that with your fingers. And then sphygmomanometer is your blood pressure cuff. So that's the fancy word for the blood pressure cuff that they put around and pump up that can really measure your blood pressure. Here's a picture of what that digital subtraction angiogram looks like. So on top you have A, which is really like the original picture, the original scan. You can see the x-ray with the contrast media. And then they go in and kind of flip that so that you can get a better picture of what's going on with the arteries. So whenever you're measuring blood pressure, oftentimes you have the sphygmomanometer, and also a stethoscope, just to kind of hear that as well. Okay, continuing on, we now have more. These are lab results. So we have C-reactive protein, and really this is something that is measured in the blood, and then if it's elevated, can indicate inflammation in the body. It's sometimes a risk or an indicator of cardiovascular disease, so that's one thing they can do. Another test that they can run is creatine phosphokinase. So this measures that enzyme of the heart, and oftentimes it's only released if the heart is injured. So if you have it present, then it can be an indicator for a heart attack, for example. Lipid profile is when they take a blood sample and they look at all the different lipids that are in your blood. You might have learned at one point again about LDLs, high density and low density lipoproteins, the good and the bad. And all of those can have a factor in heart disease, so they kind of look at that and then determine if you need medication or whatever. Troponin is another heart muscle enzyme. So this is also released after heart damage, but this is kind of a delayed release. So again, if there's that in addition to maybe the P or CPK, then that's definitely an indicator for a heart attack. Next we have activated partial thromboblastin time, or APTT. This measures anticoagulation therapy. So an anticoagulant just means that it's preventing the blood from clotting. It's kind of a blood thinner, so that maybe you can dissolve blood clots or reinstate blood flow in certain areas. So this just kind of measures that, because if it does get too thin, then you have a different kind of problem. Coagulation time is just however long it takes your blood to clot. Complete blood count and differential, CBC and diff. Really, that's just the standard blood screening. So anytime anyone comes in and they suspect something, then they would get like a blood panel. So this is going to look at your red blood cells, your white blood cells, your platelets, and just gives you an idea of overall levels to see if you have like an infection or anemic or other things. So that's what that is. Hematocrit is how much erythrocytes you have in your blood. So you could get that off of the complete blood count test, and hematocrit levels measure erythrocytes, so if you're below a certain level, that might indicate you are anemic. Hemoglobin is the oxygen-containing portion of your blood cells, but there also is a hemoglobin test, and it measures that. If you're oxygen deficient, it might be because you don't have enough red blood cells, or because you're not carrying a sufficient amount of oxygen. And then prothrombin time is a test used to determine coagulation deficits. So we talked about coagulation time and how long it takes for the blood to clot. This is a blood test kind of used to figure out coagulation problems. It goes a little bit in the same sense as the APTT. These are a lot of different tests that kind of somehow seem similar. So please make sure you work on exercise 34, 35, putting all these together and matching them with the appropriate definition. Just so that you know what a lipid profile is, I'm not going to specifically ask you about this, but just to know what's inside of it. As I mentioned, HDLs, LDLs, but they also look at things like cholesterol, triglycerides, and other things. Okay, what measures the number of times per minute the heartbeat is felt on the artery wall? That would be your pulse. Okay, we are to the complementary terms, which there is a lot based on each system. Here are all of the ones from word parts, so I'm going to kind of leave that up to you. A commonly used one again is intravenous or an IV. We see that all the time. But looking at these, there's no really new prefixes or suffixes, so I'm just going to kind of gloss over this part and have you try exercise 39 on page 393. When we get to the ones that are not built from word parts, there is a ton. And this is not quite all of them, in the sense that there is more after this related to the immune system we'll get to in a minute. But first we have a bruit. So this is a weird sound that you would hear when you're doing that auscultation process. And it really means that there's a problem with blood flow through the arteries. Maybe an aneurysm, for example. Next we have cardiopulmonary resuscitation, CPR. So that's when you obviously are giving compressions and possible ventilation to someone who cannot breathe on their own. Defibrillation, we learned about what a defibrillator is, but this is where you shock the myocardium through the chest, and hopefully that reinvigorates the correct cardiac rhythm. Diastole or diastolic, that is the part where your ventricles relax and fill with blood. So when you're thinking about your blood pressure as a number over a number, this is the bottom number. So for example, what if 120 over 80 is good? That would be the 80 value, where that's the amount of pressure when your ventricles are relaxed. The opposite would be systole or systolic. That's the amount of pressure when your ventricles are contracted, which you would imagine should be a little bit higher. Extracorporeal is a phrase that just means outside the body. So for example, if you're doing open heart surgery and you're on bypass or have a heart and lung machine, that's extracorporeal. Extravasation would be escape of blood or any real fluid really from a vessel into the surrounding tissue. So maybe if you're getting a bruise, for example, and you've broken a blood vessel and blood is going into the surrounding area, that would be extravasation. Fibrillation is the quivering or uncoordinated contraction of the atria and ventricles. So it's kind of like a system. It's supposed to be one contract, then the other. But if it's not really coordinated or is too fast, then you might have a fibrillation. Hypercholesterolemia means you have too much cholesterol in your blood. Generally increases your chances of having some kind of cardiovascular disease. By the same token, we have hyperlipidemia, so too many lipids in your blood. Hypertension just means you have high blood pressure. So generally anything over 140/90 is considered high blood pressure. So if yours is more than that, then you have hypertension. Hypertriglyceridemia is too many triglycerides in your blood. On the opposite of hypertension, you can have hypotension, so your blood pressure is not high enough. So that's usually anything less than like 90/60. Lipids are fats, which I think you guys know. A lumen is a generic term for any kind of opening in an organ or a cavity. So in this case, blood vessels, the interior portion could be called a lumen. A murmur is a cardiac sound that you also hear. Turbulent blood flow also. These are little short duration sounds in the cardiac region. So it's kind of a tiny little separate sound, different from the normal heart sounds. And usually a murmur indicates a valve problem. Occlude means to block or that it's closed tightly. So if something is occluded, then it is blocked off in some way. A phlebotomist is the person who performs phlebotomy. They are the person who draws blood from the veins or also injects IV fluids. Vasoconstrictor is some kind of medicine or agent that narrows blood vessels, and on the opposite we can also have a vasodilator, which dilates the vessels. Venipuncture is just a term that is meaning to go puncture into the vein to remove blood. So for example, a phlebotomist would do a venipuncture when they are going to withdraw blood from a vein or start an IV fluid. Anticoagulant is something that is going to prevent or slow the blood from clotting. Blood dyscrasia is some kind of pathologic condition of the blood. So there's something wrong or you're having some kind of blood disease. And then a hemorrhage is bleeding, rapid loss of blood. That was a ton of words. So please try exercise 42 to go through all of them once. These are from these are not from word parts, even though a lot of them sound like they are. So just make sure you go through. Just so that you know, here's where defibrillator paddles go, so you can kind of see them outstretched on either side of the heart there. Here, again, we have a patient's arm with a pertaining to within a vein. So that would be, there's many different ways you can do it, but this would be intravenous would be the most appropriate. Here's what the EKGs look like when you can kind of see what a normal heart's supposed to look like, and then you have atrial fibrillation where you have these little tiny little murmurs kind of or extra thing, and then if you have a ventricular problem it looks a whole lot different. So if you have leukemia, who would you go to? Probably an oncologist also, but leukemia is a blood disorder, so you would go to a hematologist. All right, so our really last list of words does go in with the immune system, and I think a lot of you know what these terms are already. So like an allergen is anything that can cause an allergy. The allergist is the person that you go to. An allergy really is a hypersensitivity to some kind of substance. So whenever a person comes in contact with it, they have an inflammatory immune response. If it's a crazy exaggerated immune response, then that's what we call anaphylaxis. So you're super highly allergic, and it could be lethal depending on your level of allergy. An antibody is what your body makes to fight and destroy antigens, which are the things that trigger an immune response. So different types of toxins or bacteria and viruses have antigens on them that our body reacts to. An autoimmune disease is one where your body can't tell its own cells apart from foreign cells. And so when that happens, then it starts to attack its own self. Immune means that you are resistant to a certain pathogen. If you are immunodeficient, that means that your immune system is not working properly in the sense that it can't fight off disease. An immunologist is a person who treats immune system disorders. They study immunology. Phagocytosis is when white blood cells destroy or engulf foreign invaders. So phagocytosis is part of the normal immune response trying to get rid of an infection. And then a vaccine is when you are administered some version or form of the pathogen, and you'll mount an immune response and then hopefully become immune from actually getting whatever disease it is. So a lot of these you've heard before, but please just try the matching on 399 that goes through each one of these, because they do sound pretty similar, but they're a little bit different in how they are defined. All right, so at the very end of the chapter, you have your million abbreviations. They are mentioned throughout the PowerPoint, but they're all listed here. So just make sure that you can look at these abbreviations and know what they stand for, and or if you see the longer word, what it could be abbreviated as. There's a pretty good exercise in 47 on page 401 that kind of just walks you through what that would be. And as always, at the very, very, very end of the chapter, there's always some good culminating things like this one on page 405 that kind of puts all of the words together in context so you can get a better idea of how they're being used as well as the quiz. All right, you successfully made it to the end.